quick overview of what this device is and why David and I fell in love with it. Okay, so this is how it comes now. It comes in a box and they're individually wrapped, and so you just unwrap it and there's a needle and the syringe in it. My favorite is the pink one, and because I love a 1 ml dilution for all the precision places that I'm injecting. The pink one, every click is 1 unit. And if you love the 2 ml dilution, then you would grab the blue one and every click is a unit. And if you're one of those on-label people, nothing wrong with that. But especially if you're a trainer and you want to teach on-label and do the right thing in front of industry and they're watching, it's going to be the green one, right? The reason that patients love this syringe is amazing because they hear the clicks and they're not thinking about the needle. They're thinking every click is a unit. Ooh, I'm getting lots of units. And they're focused on the click and not the prick.
I was part of the early experience program. I spend my time, half the time stabbing people in the face and the other half of the time doing clinical research for the FDA. So I got to work with Carla and Howard, the creators of this device, in part of their IRB study. And I got to inject about 50 patients. After I ran out of syringes, my patients came back for toxin and they kept asking for the clicky syringe. So I knew I had to buy it at that point. But what I saw when I injected those 50 patients was decreased bruising, an increase in efficacy, efficiency, and the precision of exactly how much toxin I was delivering every single time. I know most injectors in the room are females. You don't wear a size 14 ring finger if you want to buy me jewelry, okay? But 1 unit of toxin in giant man hands is not very easy to do. So now I have this precision device that can deliver exactly what I want it to deliver. So not only did my patients request it, but it increased my efficiency as well. So I don't know if you read some recent publications on electron microscopy, but BD syringes are pretty dull after the 3rd poke. So if I'm doing a full face, full neck, masseters, I'm using about 20 BD syringes, and those are about 30 cents each. So when you start doing the math, it's not as cheap as you think. Those BD syringes aren't a penny syringe. So I've been using it now. Julie, I see you're already hitting his forehead, so tell me.
Yes. Okay, so this is the inventor. This is Howard. Say hi, Howard. Hi, Howard. I'm doing a little sag test to see if his brow drops. And if it doesn't drop, I'm going to be injecting to the frontalis, which is, as we know, it glides along the bone. And I'm doing 2 clicks out here just to soften these deeper lines. He really, this is his sag line right here. And below that, his brow drops. Above it, it doesn't. So I'm gonna go, all the deep ones are gonna be above the sag line.
And what's your dilution?
1 to 1, I've got the pink one. And I'm just gonna rock and roll because I really want to do his scalp as well. All right, and it just, does it hurt, Howard? Yeah, have you stuck me yet, he says.
Insulin syringe is going to be dull after the first 1 or 2 pokes. So she is, keep going, she's not having to change out her needle. You can tell how easy it's sliding through the dermis into the frontalis muscle. And he's also a male, which means we typically have to be more nice to them. We have to be more gentle, okay? So using this 33 gauge invisible wall TSK needle that comes with it, being the narrowest, tiniest needle that we can purchase currently, is wonderful, especially because it's gonna remain sharp throughout the entire treatment.
All right, I put 25 units in his frontalis, and I think I like it.
Yeah, so each click is a pre-metered dose. So Julie is mentioning you don't have to look at your syringe, you just count your clicks. Each click is going to be a preset dose of either 0.01, 0.02, or 0.025, depending on which NavaClick syringe that you're using. Coincidentally, what I found in my patient population is that the clickiness is like ASMR.
Yeah.
Like patients really love the clickiness because they count it. And then I had a patient who I did 2 units in one part of her lateral frontalis and 1 on the other side. And she's like, wait a minute, you missed 1 unit. And I was like, wow, you're really paying attention, but your brows are crooked, so I'm fixing your brows, trust me.
Okay. To me, these run around $10 and it's like less than a cost of Botox. So you can charge your patient an extra, a little bit if you want to, but I don't. I think it's worth the patient retention because my tox doesn't hurt, and neither do my PDGFs.
Yeah, but if it proves outcomes, you're doing something that other providers in your area aren't doing to increase satisfaction, increase comfort, and give more precision dosing. It's a win all the way around, and it's my #1 use syringe now. So, Dr. Goldberg, you're back up. Come on up.
Thank you, everybody.